In Paulsboro.
You don't want her to throw up and get
Yeah, no.
Yeah, park on the side.
She's breathing. Come on, baby.
breathing.
Yeah, she's trying
That's
to.
not. She needs to get that stuff out there right
Yeah,
away.
she needs Narcan.
195 for the now.
It appears to be an overdose. No, we got nothing. I've got no call.
I got a call.
You got one?
Jay, wake up, Jay. Come on, Jay, get out of the car. Come on, Jay, get out of the car. Come on, Jay. Jay, look at me, Jay. Come on, Jay, wake up. Wake up, Jay. Jay, wake up. Come on, Jay, wake up. Jay, wake up. Look at me. Look at me, Jay. Jay, look at me. Come on. Come on, Jay. His eyes rolled back in his head. He was breathing.
You got that?
Yeah, I do. Come on, buddy. Come on. Come on, Jay. Come on, buddy. Come on back.
Got a good call.
Come on. Yeah, his heart's going. I feel it.
Yeah.
Come on, Jay. Let's go.
The tragic death of Philip Seymour Hoffman, the 46-year-old Oscar winner, brilliant actor, found dead in his Manhattan apartment yesterday from an apparent overdose of heroin.
We start with a hair-raising account of a young mother's heroin overdose with her 3-year-old in the back seat.
What makes a community? Is a community merely the people and the civil institutions, or is it something more? One could argue that the Gulag working camps were, by this definition, a community. However, does this really capture the community we think of when we think of our own home? Even Merriam-Webster defines a community as merely people living in one area. I'd like to contend that a community is something more, something that exists to lift and better all members in some way. Today, our community is facing a very real crisis, an outbreak of heroin and opiate abuse, the likes of which has never been seen before. Considering our idea of a community, it is imperative to ask, how has heroin invaded and affected us right here in Stark County? This is the issue from the perspective of the people who are fighting the effects of heroin every day from right within our community. Stark County, Ohio is a county with a population of 375,000 people in a state with a total population of 11.6 million. Stark County spans an area of about 527 square miles and is home to the Pro Football Hall of Fame, McKinley Monument, and of course, Jackson High School. With regards to Ohio's opiate and heroin epidemic, Stark County has contributed 86 deaths from 2006 to 2014. Also, nearly 7 times more people from Massillon have received services for opioid and heroin addiction than in 2006. The number of Canton residents has more than tripled in those 8 years. According to the statistics from the Mental Health and Recovery Services Board of Stark County, Ohio, in order to better understand the prevalence of heroin and the extent of the issue in Stark County, we sat down with Stark County Common Pleas Judge Frank Verschoni. So, could you talk about your experiences and observations with the drug from your position as the Stark County Common Pleas Judge?
Yeah, I think right now heroin is the most devastating and seductive drug there is. Right now it's the leading killer of our youth. And I'd say 80% of the cases that come through our court now are heroin related.
So when did we really start seeing a rise in the rate of heroin related cases in Stark County?
Well, prior to this job, I was the prosecutor for 20 years, and I don't know if I ever saw a heroin related case.
Really?
The last 4 years it started, and now it's like the ball that just keeps rolling down the hill. It's escalated, and it's all over. It's with the rich, it's with the middle class, and it's with the poor.
So what do you think has especially led to this increase in consumption? Like, was there any significant event? I believe you were talking earlier about the regulation of prescription drugs. How did that affect the increase in heroin use?
That's a good point. Ohio did not really regulate the pain medicine being out, and the National Medical Institute issued an opinion in the end of the 80s that people have the right not to be in pain. It basically allowed them to turn over any type of medication. So we were over-medicating people, and they were told that drugs like Oxycontin and things like that weren't addictive. And in reality, we now have found out they really are.
Yeah. Okay. So is there any demographic that you've seen is particularly or most affected by heroin in Stark County and Ohio at large?
Well, right now Ohio is second in the nation, so we are battling that problem. Stark County, I think last year was 8th in the amount of what's called fentanyl, which is now being mixed with heroin. It's a drug that's used for cancer patients. So we're seeing a trend here in Ohio. Why in this area? I think the majority of it is, again, 80% of the people on heroin were from prescription drugs. And right now we seem to be in the middle of this crisis.
So is there a legal punishment for people who overdose on heroin?
Yes, they could be charged with possession of heroin, sometimes trafficking, and that's generally what we see in my courtroom. We're taking the approach with young people. We don't want to put people in prison for using. Right. We get them into treatment, we get them in right away so that they can lead a productive life. The traffickers, those are the ones that we're sending to prison.
On average, who is arrested at a higher rate? Do you see more trials of traffickers or more trials of users?
Sadly, it's the users. We are not, obviously, we're trying hard, but we're not getting the amount of traffickers that we'd like to. You and I talked a little bit earlier. They're coming in from Mexico. It's being shipped in. You know, the United States has not been real successful in making the big amount of hits that we would like to get this to stop from coming in.
On a global level, the majority of heroin that comes to the United States comes from Afghanistan, and of that heroin, about 90% of the world's supply, only 1% is seized annually, whether it be in the United States or by any kind of international oversight presence. So with that low amount of seizure and that low amount of actual preventiveness for the traffickers and for actually preventing the drugs from coming in, how is Stark County addressing the problem of drugs coming in? What are the enforcement policies for if actually busting heroin?
Well, Sheriff Meyer has worked real well with federal agents. We made a couple major busts last year of I think about 18 different people. But that's, through confidential informants, phone records, all kinds of different records. Obviously, we need to probably find a better way federally to stop it. And it's coming in from the border from Mexico. I mean, I don't mean to sound like Donald Trump, but it is. It's easy to get through the United States. And so I think we need to get better border control to stop that from getting in.
Okay. So on the topic of increasing crime, has there been an increase in crime overall, or is it specifically within the area of heroin possession and heroin use?
There's been a slight increase of crime in Stark County. The violent crime has went down a little bit, but the heroin use and heroin trafficking is at record level. It's an epidemic level. Everyone's calling it an epidemic. That's how high it is.
Right. After hearing about the extent of the heroin epidemic in Stark County, it is necessary to understand the actual health harms of heroin. For insight, we sat down with epidemiologist Amanda Archer and Stark County Health Commissioner James Adams at the Canton City Health Commissioner's office.
The classic definition of an epidemic is a
sudden increase of disease or a condition in a community that's above the normal level, and it's usually associated in either in time and place at the same time. So, like a classic might be a food service outbreak, where several people get sick after eating food at a restaurant on Tuesday. So that's the classic definition of an epidemic. Epidemic usually also, that's an outbreak. An epidemic is widespread, so affecting the community at large or a larger community. And it can be expanded even farther into a pandemic, which is worldwide. So you might remember we had H1N1, the flu outbreak a few years ago. It was a pandemic because it affected most of the globe. Oh, for sure. I mean, over the last year or so, you've seen that sudden rise in the number of cases, of overdose cases within the community. So certainly that would meet anybody's definition for an epidemic. Well, I think some of your work has identified those.
Yeah, heroin is an opiate, and as far as it being detrimental to the health, it has a very high addictive property. So somebody can use heroin once and become addicted after one use. And when somebody uses heroin, it acts as a respiratory depressant. So in terms of it being bad for your health, it can put you into a state of respiratory depression where your body will slowly stop breathing, and that's when someone is actively overdosing and potentially going to pass away. Its addictive properties are, in our brain we have what are called opiate receptors. So we have very specific receptors in the brain that are specifically designed to accept opiate molecules. So when somebody ingests an opiate, Vicodin, Percocet, Oxycontin, or heroin, it goes right to those opiate receptors. And when it goes to those opiate receptors, the receptors are happy, and your body releases dopamine. So you get this feel-good response, and from that point, your body knows what that feels like, and it wants to replicate it, which is why you are constantly wanting more. Your body releases dopamine, and after that initial high, you're basically addicted because you want that feel good. Your body wants that dopamine release again. So that's one reason why it's so addictive. I would say that to answer that question, you have to kind of look back 8, 10, maybe even a little bit longer, of how we got to the point. What started this, and we know now that 75% of people who are currently using heroin started on prescription pills. So those are your prescription opiates. And they were either prescribed the opiate because they had a chronic or an acute problem or pain, or they were experimenting with opiates. So it's becoming as widespread as it is because opiates are such an addictive drug. I don't think that initially when we started prescribing opiates that we understood really what the addictive properties were or how addictive they could be. We in the United States, we make up 4% of the population of the world, and we use over 80% of the prescription opiates. I think it has to do with over-prescribing. I think we have a culture in the United States where pills can and will fix anything. And I think that we're finally starting to realize that there's a responsibility to prescribing opiates and taking opiates. And unfortunately, that's because of the heroin. We did a really good job when we recognized that there was a problem with people who were addicted to prescription opiates. We put a bunch of policies in place to try to dry up access to prescription opiates. And once we did that, we had a large populations of individuals who weren't able to get the prescription opiates that they were dependent on. They still had an addiction, and they had nowhere to go. Their options were either go to rehab or go to heroin. And some of them went to rehab, but some of them went to heroin, and that's what we're seeing now.
And heroin is cheap. It's widely available, very inexpensive. it's being mixed with other drugs that make it even more of a powerful, desired drug. So it's just very cheap, very widespread. It is the drug of choice now.
To continue the conversation on mental health harms associated with heroin and to find greater insight into how Stark County is responding to the crisis, we went to the Stark County Mental Health and Addiction Recovery to speak with Health and Wellness Manager Fran Gerbig. So what is your position or job at the Stark Mental Health and Addiction Recovery?
Well, I coordinate, as one of my responsibilities, I coordinate Drug Free Stark County, which is a coalition of community members who are working together to determine what substance abuse problems exist in Stark County and then plan strategies to prevent substance abuse. So that's my primary responsibility.
All right, so can you talk a little bit more about this coalition? Like, how is it funded? Is it designed to help with any specific group of individuals, or is it mainly for like just a broad-based service?
Well, it is funded through a federal grant called the Drug Free Communities Program, and so we do have a very specific mission. We are to promote a drug-free Stark County, and we target, quite frankly, young people ages 12 through 17, 12 to 18, because we know that the earlier that you can get messaging out and the earlier that they are exposed to prevention messages and prevention services, the more likely that we can delay onset of experimentation. And so really also knowing that the best vehicle to get to kids sometime is through their parents. We do a lot of work, a lot of education with families, caregivers, but we also recognize that the peer-to-peer message is very important. Quite frankly, it's better for you to get a message from your your friends than it is from somebody old like me.
Resonates a little bit more.
It does. There's truth to it. If your friends are doing it, you're going to want to do it too. So it's a pretty multifaceted group of folks representing all the sectors in our community, so from healthcare to law enforcement to schools, churches, businesses, and again, from youth and adults are both involved.
Yeah. So when we're talking about the actual what is carried out through this coalition, is there any what's the connection between the healthcare side of this? How do we take people who were heroin addicts and how do we transition them into functioning members of society once again without their addiction? How do you go about treating the disease of addiction?
Well, and that's a very good way to say it. You have to treat the disease of addiction, and there are a lot of different ways for people to become healthy again. People can recover, but we have to keep in mind that each individual is their own unique person, and so what treatment plan that works for one person is going to be different for the other person. And so in Stark County, we're very fortunate that we have an array of services. There are an array of meetings that people can go to, but there's something called the medicated assisted treatments process. So there are substances that help kind of control the craving for the opiate. And so while the person is learning how to cope with that craving and detox through that craving, they can also they need to partner that with some clinical therapy so that they can really address the cause of the addiction. For some people, that's the way to go. Other people can quit cold turkey, and with some support from specialists and from their family, can easily make that transition. But it's not a cookie cutter approach. People have to find out what works best for them, and because this addiction is unlike, quite frankly, any other addiction, sometimes it takes 4, 5, 6, 7 attempts before that person is going to be successful, and they are always going to be at high risk. They're always going to be at high risk. So it's going to be one of those chronic diseases that they learn to live with. But just like somebody with diabetes learns how to live with diabetes, a person with addiction can learn to live with that and be successful.
So with the introduction of naloxone, has that been incorporated in the schools? Are you seeing a large amount of heroin overdose or a large amount of heroin use within high school and middle school age children?
We have not. Now, I do think that's a very good question, though, because I think we would be kidding ourselves to think that teenagers are not being exposed to heroin, and when we are tracking our overdose deaths that we are attributing to opiates, we are seeing younger and younger adults dying from heroin overdoses. We have had some preliminary conversations with school districts in Stark County about equipping school nurses, kind of standard issue first aid with the Project Dawn kit. Some schools do have this available to them because of their school resource officers. As I said, we've provided Narcan to the different police agencies in Stark County, so if there's a school resource officer, he or she would have had that available to them. So I think it's a process that's happening. I know in the state of Ohio, the school nurses are talking about that, so I would expect it sooner than later.
The greatest effect of heroin is and will always be its human impact. Heroin takes away from sons and daughters, mothers and fathers, brothers and sisters, and friends and family. It's easy to look at a statistic when dealing with heroin overdoses and not feel the human impact that comes along with each of those deaths. In order to appreciate the real human toll of this epidemic, we met up with the Batdorf family, who lost their son, a Jackson graduate, in 2011 to a heroin overdose.
My name is Dale Batdorf, and I lost my son Dustin September 25th, 2011 to a heroin overdose. He was a Jackson High School athlete, graduated in 2008, and he became addicted to opiates and quickly changed over to heroin. And it only took him from the time he took his first opiate to the time he died about 9 months. My wife being a nurse, it was a Sunday morning. She went to get him up to go to work, and she found him dead on the floor of his bedroom.
I looked out and his car was in the driveway, and I thought, he's late for work. I went down there and I thought, this kid, I don't know what he's doing, maybe he slept in or something. And I saw the light on under his door, heard the music, and a bad feeling came over me. And I thought, something's wrong. And I kind of bursted through the doors, and that's when I saw him laying on the floor, and he had a puddle of vomit around him. He was very bluish, purplish, and rigor mortis had set in, his arms were drawn up, and I just freaked out. And I ran over, and I tried to do CPR, but I knew he was dead. But you have to try to do something. Now, if you found someone in your family, you can imagine. You just can't accept it. And the paramedics and everything showed up, and it's kind of a blur after that. It was just so horrible, and it was so shocking that I really didn't know what to do. I just sat on the floor downstairs and kind of watched, and they came in, and I said, aren't you going to do anything for him? And they just said, he's been dead for hours.
So, subsequently I become the director of SOLOS of Stark County, which SOLOS stands for Surviving Our Loss and Continuing Every Day. And it is a support group for those who have lost someone to a drug overdose. We're very instrumental in placing drug take-back boxes throughout Stark County. We have 17 of them, which are placed at each and every police station throughout Stark County. That's been one of our missions, and it's probably one of our greatest accomplishments.
After the death of his son, Dale became an active member in the Warriors Project. The Warriors Project is a movement to address the heroin outbreak in Stark County by offering counseling to addicts, supporting families, collecting prescription drugs, and spreading awareness throughout the community. We attended a meeting in order to meet with the founder, Bill Lawson, and hear his story.
My name is Bill Lawson, aka Tiny. I'm the co-founder of the Warriors Project. The Warriors Project is a grassroots movement, a band of brothers and sisters. One of our goals is to eradicate the stigma of addiction. Our goal is to treat the addiction as a family as a whole, not just the addict. We treat the family along with the addict. One of our goals is to not only to eradicate the stigma of addiction, but to come together as a community, to raise awareness in our community, and to be a voice in our community. Our goal is to become a family. You'll hear I love you a lot at the Warriors Project. You'll hear family a lot when you're at the Warriors Project. A little bit about my history. I was an exceptional athlete in high school. I got involved with some gangs, and by 17 years old, I had gotten in so much trouble. My last charge was a DUI, reckless drug abuse, willfully fleeing and attempted assault on a police officer. And when I went to court, the judge suggested that maybe it would be a good idea if I joined the military. I enlisted in the Marine Corps, and during my time in the Corps, I got involved with the 1% Outlaw Motorcycle Club, which is basically organized crime. And when I was discharged from the Marine Corps, I thought it would be a good idea to patch into that organization. And quickly I moved up in that organization as a sergeant of arms and did collections for that organization, committed some crimes in Alabama, and fled back to Ohio because I was in fear of incarceration there. Probably what I thought to be a blessing was a curse. I won $100,000 in the lottery and decided that I was going to retire as a drug dealer. Got involved with a Mexican drug cartel and inevitably got in some trouble about a year and a half later and spent some time in jail. Ironically, 7 years ago, I went back to the last place that I was incarcerated and got the keys to the place where I became a corrections officer at Stark Regional. About a year ago, I made a decision to step away from that job as a corrections officer. For 5 years, myself and Jeff Wilson, the co-founder of our project, had been putting together, we had a vision of putting this Warriors project together. I cashed in my pension, and I cashed in my deferred comp and my annuity, and I took a leap of faith. I put it in God's hands, and I launched the Warriors project with no means of an income. It started with 7 people in a meeting room at Love Canton Church, and today, less than a year later, we get 50 to 100 people that attend from our community. We thought our project was going to be just people in recovery, people that needed help, but it's morphed into something way greater, something that we didn't see. We have people in our project who have lost loved ones to overdose or suicide, addiction. We have people who have loved ones that are still struggling with addiction, are still out there. We're there for the family. They have become our family. We have people who have came and we've helped their loved ones get on track, and they're living in long-term recovery today. And we have people in recovery here today. And, you know, it's brought the true meaning to family. We knew that it had to be about family, but I think in the beginning we left that piece out. God has had his hand on this project since the beginning, and it's been shaping this into a grassroots movement. And for lack of a better word, we are a movement, we're a culture, we're a recovery culture, and it's cool to be sober today. It's cool to be a man or a woman of integrity. It's cool to be a man or a woman of your word today. That's what our goal is, to come together as a family, as a project, and to unite a whole community and to make an impact on the heroin epidemic. Thank you.
The heroin outbreak in Stark County is certainly one of the greatest challenges our community has faced in some time. The story of the people who are fighting the effects of heroin on a daily basis is one that must be told. These people have dedicated their lives to combating a drug that has taken control of our community. The efforts of these individuals has brought and will continue to bring a necessary change to our community. Together, through our own actions, we can each be mechanisms of change and bring an end to the heroin epidemic in Stark County.